Welcome to True Health Tuesday, and the truth will set you free. Okay, you'll see a unique flower up there, and it's kind of cool because I'm pretty passionate about the fruit that it gets. What kind of flower is it? Passion fruit, baby. Okay, it's just kind of cool. Okay, so we're going to talk about about 3% of all diseases in the world are genetic, kind of. Okay, there's ways to change that expression. About 97% of other diseases, okay, are not genetic. They're really adaptation. So if you've heard idiopathic, autoimmune, if you've heard these things, we're going to actually get into the causes and solutions. When I say solutions, I mean it's really going to get rid of it. In the censored portion, there is an epidemic coming, and it's of a chronic neurologic, and it's really damaging. And we're going to cover that because a lot of the problems there cannot be mentioned. Um, so if you want to watch this uninterrupted, and in order to get by the Ministry of Truth, which is really, if you're familiar with 1984, those are the group that created all the lies. Although they're doing a bang up job now. I mean, it's amazing. I didn't know used car salesmen, okay, are not as good as our government. And I mean bad used car salesmen. Okay, so thank you if you're supporting Dr. BVIP. If you're not, please help support us. If you're not supporting it, just spread it. Get the information out there because I can really see the tide starting to turn. Okay, and you may say, no, vaccine passports and this and this and this. No, the tide is turning. People are starting to wake up and realize that their boogeyman isn't out there. Extreme Health Academy. We've got so many different chronic illnesses and diseases. This is a group that I speak once a month for them for about a 3-hour seminar. It's the interactions, the webinars, the information, the multiple doctors on there. This is one of the best health resources out there. And it's, again, also uncensored. So the people in charge of your country, I know you thought it was of the people, by the people, for the people. No, I'm talking the National Institute of Health, the Fraud and Deception Association, all of these people that are really subsidiaries of the pharmaceutical industry have brought you health like this. Yes, look to the left, look to the right. 1 in 2 will get cancer. Okay. Um, wait, do you know the official cause of cancer? It's unknown. 1 in 5 will have an autoimmune disorder. 25% will have heart disease. Of course, that's going to go up quite a bit. Liver, depressed, dementia, thyroid, diabetic, chronic digestive disorders. Now, this was an old one because autism, which you don't hear that much anymore, okay, would have bankrupt just about the country in another 4 or 5 years. Can't imagine planning a pandemic like this right about now. Of course, this is something you don't hear in the news. Okay, influenza, flu. I know, it turns out, like in 17 to 18, 2000, there were 61,000 deaths. Do you know how many there were in 2020? About 1,800. No, it was 1,800. It was like, wow, that's amazing. So it turns out that the current pandemic is really the cure for the flu. Okay, so when you look at this, we're going to look at these diseases. Are they diseases or adaptation? So we're going to look at 3 stressors that are causing these diseases. I know this is going to blow your mind because you've been told it's autoimmune, it's idiopathic, okay? It runs in my family. All of that crap is not true. Physical, chemical, and emotional stress. I'm going to show you a couple of patients and show you what doctors actually do, not the one that says, what's your insurance? They step back 5 feet and they come up with a diagnosis. Now, I've done a couple of talks on the delusion of diagnosis. The delusion, the reason medical doctors diagnose is to protect their own ass. Okay, because if you're giving an aspirin, okay, for a certain condition, and that person develops kidney damage or a stroke, which are some of the effects of an aspirin, okay, then they're covered. They can't be sued because they're doing the appropriate chemical for the appropriate symptom or diagnosis. because that's what it is. It's uh, chemical therapy, which is medications for an adaptive stress response, which I'm talking 50 years from now, people will look back at this time as the most ignorant time the world's ever seen. Honest to goodness. So this person writes down, of course, part of this I can't say. Anyone familiar with Harry Potter? What was the wizard that couldn't be named? Because it was so evil, Voldemort. Okay. I know I probably misspelled it. Okay. My apologies to Harry Potterites. Okay. But we're going to call it the Voldemort virus. Okay. Because it's the virus that cannot be named. Okay. In the public, according to the Ministry of Truth. Well, he had long haul Voldemort. Okay. And does anybody think that exists? Because I know you hear it on the news and everything, and it's not just like a regular flu, it's everything else. Okay, so let's go into this, because in real doctors, and I'm talking about doctors that actually do investigation to find out why the body is adapting to this. Not 5 minutes with a friggin' pencil and a pad to say, oh, okay, this is your diagnosis, this is your prescription, thank you very much, I'll see you later. Okay, have my nurse check your blood pressure on the way out. So long haul Voldemort, and the only thing he writes down here is difficulty in sleeping. Okay, now our form is laid out into what the patient thinks is the really important to them, and they'll write down some a bunch of information, some a little bit. This is a really, tough business guy, just wants to get the thing done. Okay, and then I go in there, I find out sleep is an issue, inflammatory bowel is an issue. Now, why is that important when you're talking about a person that can't recover from anything? And you could call it a virus, you could call it a cold, you could call it a car accident, you could call it anything. Okay, but it's not that the accident or trauma or pathogen was there, it's why aren't they recovering? Does that make sense? So instead of some bullshit, long haul Voldemort, okay, then we're going to look at the immune system, because that's really what it is. It's not being initiated. Inflammatory bowel and reflux, that's one some of his symptoms. He didn't put it down because he had it so long. And why is the gut involved in lung stuff? Okay, it's not important to this. Okay, seriously, this is how people think. Well, this is 80% of the immune system. Now, inflammatory bowel diseases, what do they give you for that? Well, they give you non-steroidal anti-inflammatories. They're going to give you steroids. They're going to give you antibiotics, all three of which weaken your immune system response. Okay, then when you're talking reflux, what's reflux? Well, reflux has to do with the esophagus going down through the diaphragm into the top of the stomach. Now, on the top of the stomach, you have what's called the lower esophageal sphincter. So that muscle is weak. Now, that muscle could be weak because of compromised nerve supply, or you could have a problem in the neck leading to decreased diaphragmatic functioning, allowing the top of the stomach to pooch up, which is going to cause reflux. So now what weakens the diaphragm? It's going to be a problem in the neck. So now it's not just unhealthy lungs, and it's not poor sleep patterns. So now it has to do with, 80% of the immune system isn't working, and we know you probably have something compromised in the neck, altering diaphragmatic function. High stress job, knowing that we have an automatic nervous system, and this is in our initial. Okay, I'm just sitting down with him, and he's sitting like you, arms crossed, great body language. I'm not going to get any free information out of this guy. Okay, and I told him, I said, I should bring in the hot lights and the rubber hoses because you're giving me one-word answers, and it's driving me nuts. Okay. And then it turns out that, he might take an Advil or something. Why would you take it? Because he only wrote down sleep, right? Well, headaches. What kind of headache do you get? Oh, the normal one. Okay, what's a normal headache? How often do you get it? About a couple of times a week. Okay, so you get a headache 104 times a year. Okay, couldn't possibly be anything, except that's 97% of all headaches come from the neck. And then he also does have neck pain. So we do the test, and this is what I'm doing. I do the initial exam. I find out the underlying stressors as best as I can, even with people that won't give me information. Then we do the test on him. And these are 3 different tests to look for the nervous system, to look for the state of health is he in. Is he in a stress state or a rest and digest state? So the nervous system, one is the sympathetic dominant, that's fight or flight. That's located in the thoracic area. The other one is the rest, digest, and repair. That's parasympathetic, located in the neck and the pelvis area. That's the first number. The first number is 54. The chart shows that he is in an extremely stressed state. Now, wait, came in with lung issues, right? With a cold or a low functioning immune system. Stress state. Does that cause a healthy immune system or a weakened immune system? Hence, how would you like to watch CNN every day for the last 19 months? Okay, you're talking sympathetic dominant state. Okay, these guys are actually planning, okay, I mean, proposing to weaken everybody and stress everyone out. It's psychotic. So just realize that, and they know be going along okay in the world. The next one down is muscle tone and balance. Now, this is measuring the muscles that you don't have conscious control over. They run down on either side of the spine. They're called postural muscles. So if you're straight up and down, it should be about 95 to 100. That's normal. If you've had multiple traumas, it's going to be 67, like this guy. And I'm going to show you his x-rays. Because remember, we got to build data to find out why the immune system isn't working. Okay, this is a whole different world. Okay, we're not going to just give him steroids and antibiotics to help with the lung function. The bottom number is the rolling thermal scan. Now, this measures organ and gland function. Now, it should be, because every part of the body, your body is either building tissue or tearing down tissue. It's either anabolic or catabolic state. It's never static. Like that flower I showed you. Anyone in here, can you stop it from growing? No. It's either going to die or grow. Okay, that's how humans are. Okay, and the passion fruit is really, really good. Okay, so this one, if it's 70, that's more of a catabolic state. If it's 90, it's more of an anabolic state. So he's in a catabolic state. He's working way harder than he should because there's going to be some structural abnormalities, and he's in a chronic sympathetic dominant state. Let's look at the thermography. Now, the thermography, this is measuring heat. We're not looking for colors. We're looking for symmetry. One side should be the mirror image of the other. Now, looking at this, we're seeing an asymmetry on the forehead. What that means is there could be a sensitization of the mucous membranes behind it or an increased problem with the sinus. Now, the sinuses and histamines, because when I'm checking him, I'm touching his skin and it's starting to turn white when I touch him. So that means excessive histamines. Typically, it's going to be a leaky gut. We already know he's got that because he's got the inflammatory bowel system and the reflux. Okay. No, all doctors do not do this. They should. Okay. So then we're also looking at possible dental toxicities. Now, lymph drainage for the whole face and mouth drain to the right chest area. Okay. Lymph for the gut drains to the left. So if we see an asymmetrical firing on the right chest, you got to think pulmonary, sinus, dental. On the left side, that's where lymph drainage from the gut, thinking more gut related. Here, what we're looking at is possible dental toxicities. We're looking at possible TMJ. Here's the chest area, a little bit of dental toxicities, but we're also looking at the area of the inflammation of the liver, and the liver is the emotion organ. So this indicates possible high stress, possible some type of toxicities, because again, we're only looking at possibles to guide us in the direction of dealing with this physical, chemical, and emotional stress. This is actually what the structure looked like. Now, we're looking at the rib cage area, massive deviation, massive. And that's a nerve supply to the heart. So this guy dented the rib cage. Possibly it was more than 20 years ago, and I'll show you how we came up with that because of the degeneration in the neck. But that's a nerve supply to the heart. So imagine if you had this chronic irritant, structural irritant, physical stress, okay, in the nerves that supply the heart. Good sleep or poor sleep? Poor sleep, yeah, that's the only thing that he put down. Okay, but now when you're looking at the gut area here, see those black areas? What we should see in the dark areas is the ascending colon about the distance or the diameter of a stool that comes out. Ascending colon, transverse colon, descending colon into the sigmoid. You should see some gas in those areas. Not all over the place, clustered over the stomach area on the left-hand side. That's called an abnormal bowel gas. And what chronically happens is called small intestinal bacteria overgrowth, which gets in the small intestine and gives little tiny tubules like that. Where does that come from? Low stomach acid, because it's not destroying the pathogenic bacteria that you eat with. Okay, and then it expands out. We already identified leaky gut, chronic stress. Does that make sense? Okay, so let's follow it on a little bit more. Let's look at the neck. This is a reversed curve in the neck. That means that he had torn or had a whiplash trauma injuring the posterior longitudinal ligament. Now, how long ago? It takes 3 to 5 years to see a bone change on x-ray. What are you seeing here? Significant bone changes, because all those bones should basically be about the same. The ones at the lower end of the neck are compressed, distorted, reversed. Okay, so now how do you tell if you can fix it? You got to take a stress x-ray, have him look up. And sure enough, that's the x-ray, him looking up next to it. So now we're looking at between 15 and 25 years that this could have been 30, 40 years ago. That's not anything recent, but minimum 15 to 25 years. Okay, because there's a minimal amount of destruction, but people can be moving and push themselves. And if they move more and push themselves more and take less drugs, they deteriorate less. Okay, and so this guy's not even 60 yet. So we know that the joints are still viable, so we can move. But let's check out the lumbar. So the one in the middle is the person standing straight. The one on one side is bent in one way, but on the other side is bent in the other way. And this is the way, so the person's weight bearing, so we can identify abnormal dysfunction. Now, why is this important? We know there's abnormal bowel gas. We know that. So is that from low stomach acid, some type of stress state? We know he's in a stress state because we have that chart. Where's the stressors coming from? So we got to look for the disc. Now, on the bending film, the disc should open up this way. If they open up the opposite way, where they're bending in the opposite direction, we know that that's abnormal disc. You can call it disc dysfunction. Okay, and I call it disc dysfunction because you've heard of slip disc, bulging disc, herniated disc, right? Okay, those are ridiculous terms. Okay, because it isolates one area. You're not looking at the whole body. Now, this guy had 1, 2, 4 abnormal discs. This is interesting. This is the side view of his low back. Now, a normal low back curves in the front. His is curving, it's got virtually no curve coming down until you hit the bottom part. So this is a lumbar whiplash. This is like riding your bike into a tree where you hit here and flip over. Now that's important because right where I put that red arrow, okay, on the left side, that's where the end of the spinal cord is. The spinal cord stops just about at the thoracolumbar junction. So it continues, the nerves continue on. It's called cauda equina, or horse's tail. And I've got a spinal cord here. You can take a look at it. But where the worst trauma in the side view of the low back, where he's got 2 abnormal discs on the bending film, is right at the end of the spinal cord. Now you put pressure on there, that's compromising the nerve supply to the entire gastrointestinal tract. That's 80% of the immune system. That's where serotonin's produced. You decrease that, guess what happens to anxiety and stress? It goes up. When people say, wow, I had a disc bulge, okay, and I say, no, it's a disc dysfunction. And because if you think that the disc, the L5S1 disc, the one down here, or this disc, or people who come in all the time, and say, my doctor said it's L4, L5, it herniated like 5 years ago. Okay, really? Is it still herniated? Did the idiot not fix it? Okay, did he just give you drugs that destroy your body? Okay, no, just try it. Sit up straight, nice and straight in the chair just for a second. Okay, slide off to the side 2 inches. Just hang out for a little bit. Okay, where do you feel it? Okay, maybe in the shoulder, maybe a little in the back, maybe a little in the pelvis. Okay, his body is laterally shifted about 2 inches. Okay, do you think if this guy stands like this, and this is normal, this is, if you stand at 5 hours a day, those discs are under that constant pressure. And somebody is going to say, yeah, it's that L5S1 disc down there, boy. Yep, we fixed that one. You're just going to be fine. That's why when you're looking at 70 to 80% of the disc surgeries fail. If you're doing more than 2 segments, they're going to fail 80 to 90% of the time. Why? Because they're not fixing the force loading, the biomechanics, or anything else. Does that make sense? So what do we do with this guy? We fix the physical, chemical, and emotional stressors. Remember, the long haul Voldemort, okay, I don't think they're going to get that in 50 years, but for Harry Potter fans, brother, okay, was just the alarm. Okay, now when we look at this, the gut-brain axis, enteric no, what about anxiety? He didn't have that. What about multiple sclerosis? Okay, demyelinating disease. See, your body is only alive because you're able to break proteins to amino acids. So you got the amino acids. You break fats to fatty acids. You can build hormones, and carbohydrates to usable sugars, so you can get the energy. Anything that disrupts that metabolic action disrupts your body's ability to live on this planet. Okay, honest to God. And this one here, why is the gut-brain axis 90%? And those nerves, that vagus nerve that comes down, that functions every one of that breakdown and of the nutrients, 90% of it is sensory, goes up to the brain. So what kind of sensory input? Intestinal permeability. This guy had it. Okay, it's a leaky gut. Does he have Parkinson's yet? Does he have a shaking? Does he have a tremor? No. But how many people have had those traumas and they're holding a coffee cup and they realize that their hand's shaking? Just a little bit. Just a little bit. You hardly even notice it. Okay? And then they'll lie to themselves. They'll say, well, it's just the end of the day. Do they have decreased neurotransmitters? Do they have a neck trauma pulling on the brainstem? It's the ignorance and arrogance of the medical system that drives me nuts, because these guys are respected. And I mean respected to the godlike status. I mean, there's only a few. I know, like the great god F. What is he? Fuji? Okay. So look at more direct, imagine if your body was intelligent, built by God, and gives symptoms for a reason. Okay, instead of your doctor is all seeing, all knowing, ask your doctor if this is right for you. I'll tell you right now, they don't freaking know. Okay, if I give everybody in this room a vitamin C, are we all going to react the same way? No. I give everybody a Tylenol, are you all going to react the same way? No. If you're taking a blood pressure, cholesterol, Tylenol, NyQuil, everything else, and I give everybody a third medication or a Voldemort shot, is everybody going to react the same? No. So this is a lie being perpetuated on the public. Normal blood there, stress blood, okay, and chronically stressed blood. Normal blood can hold oxygen. When you get into stress, it's not going to hold oxygen. So what happens to your blood pressure? If your blood cells cannot hold oxygen, it goes up. When you're in a state of chronic stress, this means low stomach acid, your blood cells start clumping together. Now, still, every 20 minutes, your 6 quarts of blood got to go through that kidney. Okay, so if you got stressed blood and your body is forcing this clumped up blood through the kidneys, you're going to damage that functional unit called the nephron. So high blood pressure is really an adaptation to toxic, inefficient blood. Blood has a function. It carries oxygen, balances the pH. I mean, it's amazing stuff. But when there's stress, when it clumps together, it's not going to be efficient. How many doctors out there look at the live blood cell analysis or look at the stressors when they diagnose you with high blood pressure? Yes, I know, most chiropractors, most naturopaths, most homeopaths. Okay, that's a small section. There's 600,000, 700,000 MDs, okay, in America. That's a healthy society. No, I just read you the stats. Okay, 1 in 2 got cancer. Everyone's going to be sick. 60% of adults have a chronic illness. 54% of kids have a chronic illness. The system is failing because it's doing stupid shit. Okay? It's not appreciating the body. You live your life through the nervous system, sympathetic and parasympathetic, in your stress state or regeneration. If you're stressed, you're not regenerating. If you're regenerating, if you build cells faster than you tear them down, that's called health. If you break down cells faster than you build, that's called a lack of ease. You can call it a dis-ease. To find the source of that buildup or breakdown process, that's huge. Now, the average person, 65, I'm 61 and a half. I always feel like 61 and a half. Okay. Because you got to see, because people tend to hide their age. I think the older I get, the smarter I get. So I want to keep telling people, yeah, I'll keep you updated on it. But when you get over 85, 90, okay, people want to tell you, man, I'm a 93 and a half. Yeah. Okay. It's cool. So 7 drugs a day. Nobody knows what 2 drugs do. Nobody knows what 3 drugs do. So 7 drugs a day is insane. Insanity. Now, these are just the most common medications out there. Advil, Motrin, Aleve. Okay, all of these things, they're non-steroidal anti-inflammatory. Curcumin works better. Okay, we have curcumin, we have omega-3s, everything else. And so when I have patients come in and they say, yeah, man, I've been taking the Advil, Advil, 4 or 5 a day, and, it really takes the edge off. And I go, yeah, you don't seem like you're really comfortable now. Okay, how about taking something that doesn't destroy the joint cartilage, doesn't damage your kidneys, doesn't increase gastrointestinal bleeding, increase blood pressure, accelerate osteoporosis, as liver toxicity, eye toxicity, creates vital nutrient deficiencies, inhibits cartilage, folic acid deficiencies. How about taking something that helps the inflammatory process so your joints can heal and grow? Like omega-3s, like vitamin C, like a green smoothie. Okay, stuff your grandma would say. Here's another patient, probably the sweetest gal you ever saw. Okay, and she's over 80. Okay, over 80, and when you see her X-rays, you're going to be blown away. She filled out a whole bunch of stuff. I mean, she just darling. If you ever see the sweet gal walking down, and you just want to pick them up and cuddle them, because they're just like the ultimate grandma, this is it. Headaches, digestion, low back, breathing, anxiety, sleep, neck pain, memory loss. Okay, all of this stuff that makes sense. But she's taken type 2 diabetes drugs. Now, type 2 diabetes drugs, that's 95% of all diabetics on the planet. Okay. And when you take the drug, we're talking type 2 diabetes, that can be cured in about 30 to 45 days. Look at Gabriel Cousins' work. Okay. Look at Simply Raw. It's probably still on YouTube before they ban it. Okay. But it lowers blood glucose, but insulin levels remain high. So taking metformin actually increases your risk of cardiovascular damage. Then taking, what was it? Nitroglycerin, Spiriva. Now, Spiriva is a breathing thing, because if you're taking something, do you think your blood's healthy when you have type 2 diabetes, or it's a little on the thick side? Okay, so she's also taking some breathing stuff, and she came in wearing a mask. And I said, "Hun, why are you wearing a mask?" And she says, "Well, my kids want me to." And I said, "Okay, are you sick?" "No." Are you afraid everyone else is sick?" "No." "Are you wearing it just for my kids' sake?" "Okay." And I said, "Well, I got to see your facial, because I got to see symmetry of the face. Okay, we have a safe environment here." So she takes it off, and she goes like this. Constantly breathing through a sock or a face diaper. It's mind-blowing, mind-blowing. And so I gave her some data on face coverings and how they actually weaken the immune system. And here's what I tell people: anything you do that weakens your immune system is bad. Anything you do that strengthens your immune system is good. Everybody got that. Is good. Okay, yeah. So I mean, it's real basic common sense stuff. So we go in there, find out, yes, she is over 80, and she's got a better score than the guy, okay, who I just showed you, who's under 60. But she still is in a stressed state. Now, where are the stressors? Okay, if you look at the first number there, that has to do with the musculoskeletal system. So she's under a significant physical stressor. The organ and gland control, it's a little low. So that means she's breaking down a little bit more tissue. Obviously, she's taken like 5, 6 different drugs. And if any relative has taken the drugs, you can't legally tell them to not take them. Only the doctor that prescribed them can tell you. It's the religion thing because it's the religion of medicine. There's no science based in there. So, well, there's a little science, but not much. Because if anybody is curious about that, what happens if you take the Spiriva with metformin with the non-steroidal anti-inflammatory with this? Anybody know? Nobody does. Okay, so honey, separate the drugs by at least a half hour. Okay, you're going to be okay. You're going to drink more water. We're going to get you better. This is her neck. She has just a slight forward head carriage, okay, but almost no degeneration. Minimal. I mean, barely grade 2. It's more likely grade 1. Okay, arthritis. And she's over 80. So if anybody says, and these are 2 patients I had yesterday. Okay, so this isn't, I just picked them up yesterday. Okay, I'm not going back to research. And this is what I typically see when people say, hey, look, what do you ever see a perfect neck? And I said, well, the most perfect necks are the people over 75 and they grew up on a farm. And look, yeah, right. No, they're over 75. They move every day. They sleep correctly. They exercise. They get physical exercise. They eat healthy. They're typically more normal. This is more normal. She's got beautiful, except she does have some dental issues going on. They did put a pacemaker in her, which drives me crazy because the pacemaker, the heart has 2 nerve supplies, one here and one in the top of the thoracic area. She's got a significant structural deviation at the top of the thoracic area. Now, wouldn't it be nice if somebody said, wow, you have cardiac arrhythmias. We need to check the autonomic nerve supply to the heart. Let's send you to somebody that can identify problems in the neck or upper thoracic area, correct those problems, and show a change. Would that make sense? No, baby, here you go. Take this beta blocker, okay, that's going to block the sympathetic nerve supply to the heart. We know that where the sympathetic supply is, but we're not going to go in there and send you to a professional that's going to get it corrected because that's not a pharmaceutical industry. Okay, but we are going to give you this beta blocker that can damage your heart and weaken your immune system and slow oxygen down to the brain. Almost guarantee that you're going to get dementia and memory problems. Or we'll put a pacemaker in. So, I mean, is my anger showing? Because it should. Because when you see this angel and human beings, honest to God, man, they're made in the image and likeness of God. Just imagine if that was true. Okay, just imagine if their body was an intelligent design and gives symptoms for a reason. God didn't build this structure and say, hello, pharmaceutical industry, I screwed up on, I finished everything, but I really screwed up on the immune system. Need your help on that. Make as many chemicals as you can. Okay? No. This is a significant leaky gut. Significant. This is where neurotransmitters are produced. This is her. I mean, this breaks my heart because this is from chemicals that she's consumed, chronic stress that she's been under, but mainly the drug she's given is destroying her gut, destroying her gut. She's got a few disc injuries, but it's going to be easy. Okay, easy to correct. Does that make sense? Okay, and then when I'm asked, osteoporosis, what can you do? My bones are so thin. I'm afraid to get adjusted. And I said, well, hun, we use our, 1 to 2 fingers. We use about 2 to 3 pounds of pressure. And your osteoporosis is going to be resolved very, very quickly. And guess what you did? Okay. What does osteoporosis come from? Do you think it's nutrient deficiencies? Not usually. Osteoporosis is usually from acidic, toxic blood. It means low lung function because you get rid of that. That's carbon dioxide. Okay. You keep that carbon dioxide in, your blood acid levels go up. Okay. And the body is going to go to the bone bank and withdraw calcium to alkalize the system. So what do you got to do to correct osteoporosis? And we got all the videos out there. They're still up there, thank God. Okay. You alkalinize the blood. And that's respiration, perspiration, pooping, and peeping. If you get 1 poop every other day, guess what? Acidity. Okay? If you're not breathing, because you're not exercising because you're hurt, or you have to wear a face diaper all day long. You're not getting good oxygen transfer. Okay, the perspiration. You're hurting so you can't sweat. And no one ever told you to get into the sauna. Okay, and pooping, you get 1 bowel movement a day if you're lucky. Okay, guess what? That's acidity. Now, I told her, I said, if you break a bone, honey, 4 to 6 weeks later, it's brand new. Guess how long it's going to take to correct the osteoporosis? It's going to take about 3-4 months. Okay, the reason is because she's still taking a ton of drugs. With the type 2 diabetes, we got to get her out of the stress state, change her sleep pattern. That's going to take about 2 weeks. The breathing issues, we gotta get that gut healed. That takes around another 3-4 weeks to heal. Okay, but we're gonna do that at the same time. And once she gets up to about 2 to 3 bowel movements a day, we're gonna start to examine her and see how her body is adapting. Okay, and then we send her off to the guy that gave the drugs because it's a religion. Okay, you can't say, look, honey, check your blood sugar. But what I am going to tell her is check your blood sugar, because it takes about a couple of weeks on a plant-based diet, getting deep sleep and everything else. You're going to start to see that the blood sugar goes to normal. And then I want you to call the doctor that gave you this, okay, and tell him, he's managing. Okay, no, you're correcting. There's a difference there. Okay, just tell him that you made some lifestyle changes and this is your blood reading. Can you not take it? And you're going to be very diligent doing it. And he'll give you a lecture to say, this is life-threatening, blah, blah, blah. Okay. And then, you'll call him up in a couple of weeks and say, yeah, it's still the same. Okay. Because once the gut's healed, that's 80% of the immune system. Does that make sense? So your body gives symptoms for a reason. I know, say it with me. Wow! I thought it was genetic, bad luck, bad genes. And it's something, it's idiopathic. Okay, no, your body is responding correctly based on the stimuli. That's it. Bottom freaking line. Does that mean Parkinson's, MS, blood pressure? Yes. It's responding correctly based on the stimuli. You change that stimuli, you're going to change the body adaptation. Does that make sense? Yes or yes? Yeah, I'm not giving you a choice there. So this is what you do. You find the physical, chemical, and emotional stressors. Okay, I already detailed out that. Stop neurotoxins. Neuro means nerve, toxin means poison. Don't take MSG. I got a sweet gal, and this gal is like freaking amazing. I adore the heck out of her. But when she brings me this stuff that I know's got MSG, okay, and it's not on a fast day, okay, I take a little bite and there's a little something funky in there. Okay. I'm not going to give it to somebody I don't like because it's bad karma. Okay. So look at the neurotoxins in the food, look at the neurotoxins in the meds, look at the neurotoxins in the environment. If you have a symptom, do not take a chemical to cover it up. Okay. Find the source of it. I mean, we're in the second part that has to be, protected from the Ministry of Truth because they are funded by the pharmaceutical industry. And we're going to talk about some of that, which you can't talk about in public. We used to have freedom of speech, but I didn't realize it was a privilege. I thought it was a right. Okay, so when you're looking at this, find the problem. If you're taking a medication, find out why you're taking it. If you think you're taking it for inflammatory bowel disease because it's genetic, that's not true. If you're taking it for high blood pressure because it runs in your family, that's not true. If you're taking it for an autoimmune disease because, you got three, an aunt and a mother that has it, that is not true. Okay, why? Because your great grandma didn't have it. Okay, your great 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 grandma didn't have it. You wouldn't be here. Okay, there's going to be a toxic or deficient or adaptive response. If you got a leaky gut, gluten-free, dairy-free, honest to goodness. That actually works. Start getting huge amount of fermented foods in there. Juicing and blending will start to have soluble fibers, so it starts to clean the arteries. That also has antioxidants, so it makes inflammation work in the body. Plant-based organic isn't vegan. You can eat animals, but they got to be healthy animals. Just don't eat them every day, because when you're in a stressed state, It takes a huge amount of stomach acid to break those animal proteins to amino acids. It's way easier to like plants to plant acids. And I just roasted a lamb this weekend. 17 people had it. It was amazing. I'm the lamb cooker. Okay, deep sleep. If you're not sleeping good, you're not regenerating and reprogram your emotional state. Because if you've been in a stress state for a long time, there's ways to reprogram. We got videos on all this stuff. Okay, does that make sense? Find the cause, correct it. That's why we put this up at the end of every video. It's literally the nervous system, the exercise, nutrition, rest, prayer, meditation. Virtually everything else, 97% of diseases are adaptations to a toxic and deficient environment. The ignorance of the modern medical system is they're drugging that adaptation. They're giving you poisonous chemicals that all cause the same effect they're designed to treat. If you're saying, no, dude, that can't happen, look on the freaking bottle. What does it say on antidepressants? Suicide and suicidal thoughts are some of the effects. What does it say on muscle relaxants? Muscle spasms. What does it say on joint? Pain causes joint destruction. Okay? So look at that. Let's change the world. Does that make sense? Okay. We are now going to start the dangerous part, the part that is not, that will not be approved by the social media people. So if you're watching it on Dr. BVIP, beautiful, you'll see it uninterrupted. But I just want to read this. This is Ronald Reagan. I know he was an actor, okay, but he acted like a really good president, okay? I liked him. I liked his speeches. I could get behind him. But I like what he said here. Freedom is never more than one generation away from extinction. Is that pertinent today? We didn't pass it on to our children in the bloodstream. It must be fought for, protected, and handed on them to do the same. Or one day we will spend our sunset years telling our children and our children's children of what it was once like in the United States where men were free. Wow. Wow. Is that today or is that today? Okay, it's up to us. Okay, I'll see you later, YouTube, Facebook, and hello, Dr. BVIP.